And let's continue our focus on healthcare this afternoon. A new national inquiry into the treatment of osteoporosis has revealed major deficiencies in the way patients are diagnosed and cared for. The Parliamentary Group on Osteoporosis says opportunities for diagnosis are being routinely missed. It says it's putting people at risk of serious long-term bone injuries, hindering their quality of life and costing the NHS huge sums of money. Joining me now is Craig Jones, Chief Executive of the Royal Osteoporosis Society, which managed the inquiry. Welcome to the programme, Craig. First of all, just explain to us how widespread a problem osteoporosis is in the UK.
Well, osteoporosis is one of the most urgent threats to people living well in later life. It affects half of women over 50 and a fifth of men. So that's every other mother, every other grandmother. And the problem is that we're seeing delayed diagnosis push a lot of people towards crisis point, because despite how common the condition is and how costly it can be for the system, particularly on hip fractures, so few GP surgeries are identifying people who are at risk of fractures early on, and that's a missed opportunity.
It's interesting that you bring up that it affects half of women over 50 and a fifth of men. Can we zoom in on the women aspect of this? Because obviously osteoporosis is often impacted by the loss of hormones in middle age, so i.e. menopause has a big impact and can cause osteoporosis in women. So would it help if there was better diagnosis for menopause and perimenopause, and perhaps more prescribing of HRT, which is actually, I know myself, I was diagnosed as osteopedic, and then I started taking HRT and reversed that condition.
Yes, that's absolutely right. There are such strong links between the menopause and osteoporosis. So when we see the menopause campaigners saying that there needs to be better access to HRT, we're very supportive of that. It can play a really valuable role in strengthening bones. It's not for everybody, but it does, in appropriate cases, act in a very positive way to keep bones strong for life. And what we'd like to do is make sure that everybody has access to the safe, effective medications for osteoporosis, so that we can stop people getting to crisis point and having to suffer spinal and hip fractures. Very sadly, we are missing opportunities to help thousands of people.
So why is there such difficulty in diagnosing osteoporosis, or such challenges in getting it diagnosed?
Well, the data we collected as part of this inquiry says that there's simply a vacuum when it comes to oversight of standards of care. So 74% of commissioners couldn't tell us what proportion of GP surgeries in their area actually had a process for identifying people who are at risk of fractures. Follow-up of people is very important because it's a complicated treatment regime to stick to. 97% of commissioners, almost all of them, didn't have a process for conducting 5-year reviews. So the reality is that the standards that people are entitled to expect on the NHS are not being policed by the system. There are systemic failures, and that means that people are having to live with something like 3 or more fractures for a quarter of women before they actually get a diagnosis. And they are a tragedy for individuals because it's harder to recover from more serious fractures, but also very, very expensive for the system. It would take just 1% of our £2 billion we spend on hip fractures every year to have early intervention to catch people after the first fracture.
And of course, things like hip fractures and so on make a person immobile, which then causes other conditions which go on to cost the National Health Service an awful lot of money as well. I mean, how much money do you think the NHS could save if it acts on your findings?
Well, a really significant part of that 2 billion on hip fractures, and you're absolutely right, there is a knock-on benefit for ambulances, for social care costs, also for acute hospital bed days, that 1 million of which are taken up every year by people with hip fractures. We're calling today for a national screening programme because you can ask very simple questions in GP surgeries. It's quick and cheap. You can do it in 5 minutes. And if we got people onto the safe therapies that exist, we could unlock huge demand on the NHS. So there's not just a moral case to do this, there's a very strong financial case to do it as well.
Well, speaking of the safe therapies, I think there are 500,000 women in the UK on HRT. There are 16 million who are peri or menopausal. So I suppose HRT being prescribed more widely would be one thing on your list of key changes. What else are you asking the government and the NHS to do?
Well, good and equitable access to HRT is certainly one of them. The other things we're calling for, in addition to the national screening programme, is let's make it so that healthcare professionals learn more about osteoporosis in their training and education programs, because it just doesn't feature very much at the moment. And that means that one of the most common long-term conditions, one of the most urgent threats to women's health in particular, just isn't featured on the curricula in the way that it should be. We're also calling for a national specialty advisor to be set up within the NHS to have strong, visible leadership within the system. The national screening programme is the biggest recommendation today. But more than anything, we just asked the government to think again about its women's health strategy, because there were a couple of paragraphs in there on osteoporosis. But given how strongly this is linked to menopause, we need a concrete action plan for ending the unfairness. 90,000 people are missing out on treatment every year. That needs to change.
Oh, we're used to unfairness, Craig. Speaking for my sex there. Craig Jones, Chief Executive at the Royal Osteoporosis.
Thanks, Craig.